Hello everyone, welcome to TryRide. This is Pack 365, myself Srija. So today you are going to learn about the ICD-10-CM coding guidelines for diseases of the endocrine system. So introduction to ICD-10-CM. I already told you about the introduction to ICD-10-CM. I will repeat you once again. ICD stands for International Classification of Diseases, the 10th revision, and CM stands for the clinical modification. So this ICD-10-CM, it is a system used by doctors, hospitals and coders to record and classify the diseases for medical records and billing. So every disease or every health condition has a unique code in this ICD-10-CM classification. So what is endocrine system? The endocrine system, it's made up of the glands that release the hormones into the bloodstream. So these hormones, they control the important body functions like growth and development, metabolism, reproduction. So the endocrine system diseases are found in the chapter 4 ICD or 10-CM. So what are these codes? E00 to E89. So this code ranges from E00 to E89. So this chapter also includes the nutritional diseases and also the metabolic disorders. So what is nutritional disease? Like vitamin deficiencies. Whereas coming to metabolic disorders, it describes about the high cholesterol or obesity diseases. So now let's talk about this guidelines. So chapter 4. So chapter 4 of ICD-10-CM, it includes all the hormonal and metabolic disorders such as diabetes mellitus, thyroid disorders, and nutritional deficiencies. So first coming to diabetes mellitus. So what is diabetes mellitus? So how do you define it? It is nothing but it's a condition in which the body has problems using or producing insulin, right? When your body has a problem using or producing insulin, so what happens? It causes the high blood sugar levels. So that condition results in the diabetes mellitus. So ICD-10-CM gives combination codes that show the type of diabetes, whether it is type 1, type 2 or etc. and the body system affected. So which body system, which part of the body is affected? For example, like kidneys, eyes and nerves. So what complications are caused by the diabetes in your body, like neuropathy, nephropathy, etc. So how to code diabetes? So how to code diabetes? Each diabetic condition should include all the complications that the patient has. Use as many codes as necessary from the categories E08 to E13. So this fully describes the condition, patient's condition. So codes are chosen and sequenced. So based on the reason for the visit. So for example, if a patient comes in for a diabetic foot ulcer, so this foot ulcer code should be sequenced first, then followed by the diabetes code. So next coming to type of diabetes. So how many types of diabetes are there? There are two types, type 1, type 2. So type 1 diabetes, this usually starts in childhood or the before puberty. So but age alone doesn't determine the type. Whereas type 2 diabetes, it is most common diabetes in the adults. You can see elder people. So it's linked with the lifestyle factors, but can also occur in younger people sometimes. So in simple words, when coding diabetes, you must only remember few points such as what is the type of diabetes and which body system is affected and what complications are present due to diabetes. Yeah. So coming to the next slide. This is pre-symptomatic type 1 diabetes mellitus. So what is pre-symptomatic type 1 diabetes mellitus? This refers to the early stage. Pre-symptomatic is nothing but early stage. So early stage type 1 diabetes. So whenever a person has no symptoms yet, the person will not have any symptoms, but the test shows the diabetes will likely develop later. So that condition is called as juvenile diabetes, pre-symptomatic diabetes. So this starts usually in children or teenagers. For example, code E10.8. This is type 1 diabetes mellitus, pre-symptomatic. So use this code when diabetes hasn't fully developed, but early signs are found in the test. So coming to the next one, when the type of diabetes mellitus not documented. So sometimes the doctors doesn't mention whether it is type 1 or type 2 diabetes. So in such cases, what you should code? The default code is type 2 diabetes. If it's not clear, so which type of diabetes the patient has in the medical record, yeah. So when the type of diabetes, it is not clear which type of diabetes the patient has. So the default type is always type 2. So you have to code the E11 category. So the next guideline is diabetes mellitus and the use of insulin, oral hypoglycemic and injectable non-insulin drugs. So under this guideline, if the record does not mention the type of diabetes, but says the patient is insulin or oral medications, it should still be coded as type 2 diabetes. Even if insulin is used, but the type isn't written, then it is also always coded as the type 2 diabetes, because type 2 patients can also use the insulin or oral drugs for blood sugar control. So the additional codes. So when coding diabetes, you may also need to show what kind of medication the patient is currently using to manage the blood sugar. So in such case, you need to code the additional code. So these are called as J79 codes, the long-term use codes. So why to add these codes? Tell us how the diabetes is being treated, whether with insulin, oral drugs or injectable non-insulin drugs. So if the patient uses both insulin and oral hypoglycemic drugs, so assign two codes. So what are the two codes you must need to assign? First one, J79.4, which is for long-term use of insulin, and the other J79.84, the long-term use of oral hypoglycemic drugs. So this patient takes insulin shots and diabetes tablets regularly. So if the patient uses both insulin and injectable non-insulin drugs, you have to assign these codes. What are the codes? J79.4 for long-term use of insulin, whereas J79.85 for long-term use of injectable non-insulin anti-diabetic drugs. So non-insulin means there will be no insulin, and anti-diabetic. So anti means before. So before diabetic itself, this drug should be given. So the patient takes insulin and also the another injectable diabetes medicine that is not the insulin. So the third condition, if the patient uses both oral and injectable non-insulin drugs, non-insulin, no insulin. So whenever patient uses both oral and non-insulin, you have to assign two codes again. One is J79.84 for long-term use of oral hypoglycemic drugs, and the another code is J79.85 for long-term use of injectable non-insulin anti-diabetic drugs. So here the patient takes diabetes tablets and also a non-insulin injection. So you should not use here J79.84, because J79.84 is only for the insulin use, not for non-insulin use. So if insulin is given temporarily just to control the blood sugar during a hospital visit, so it must be for long-term use to assign this code. So the next guideline is here in this guideline, you will know about how the diabetes in pregnancy is coded. So whenever the diabetes mellitus in pregnancy is diagnosed, so some women have diabetes before pregnancy. So that is called as diabetes in pregnancy. So some women develop diabetes only during pregnancy. So this is called as gestational diabetes. There is a difference, right? So already you have diabetes before pregnancy, you will code as diabetes in pregnancy. Only you develop the diabetes in the pregnancy, it is called as gestational diabetes. So what ICD-10-CM coding should be followed to assign the codes for diabetes mellitus in pregnancy? So for diabetes in pregnancy, you should code from 024.0 to O24.0 to O24.3 code ranges. For gestational diabetes, that is pregnancy induced, you have to code from ranges O24.4 to O24.9. So if diabetes existed before pregnancy, use diabetes in pregnancy codes. If it started during pregnancy, use gestational diabetes codes. Simple. You have to just remember these 2 points. And there will be complications due to insulin pump malfunction. So what it is? Complications due to insulin pump malfunction. The first one, underdose of insulin due to insulin pump failure. So sometimes patient uses the insulin pump. Insulin pump is nothing but it's a small device that delivers the insulin automatically. So this pump fails, it can cause too little or too much insulin to be given. So what happens if underdose of insulin taken? The insulin pump didn't deliver enough insulin. So this is called as underdose, right? Not getting enough insulin is called as underdose. So first you have to assign the code from subcategory T85.6. This identifies that the pump is malfunction. And then you have to add T38.3x6 code. So this denotes the underdosing of the insulin and also the oral hypoglycemic drugs. So this shows that too little insulin was delivered. So finally you have to assign the additional codes for the type of diabetes. So what is the type of diabetes or any complication caused by the underdose? You have to assign the codes for those. So what is the important note over here is you have to always code the disease problem first, then the drug underdose, and finally the diabetes side effects. And coming to next slide. Overdose of insulin due to insulin pump failure. I already said the insulin pump delivers oxygen continuously to help to control the blood sugar. So if the pump malfunctions and releases too much insulin, in the before slide you have learned about underdose means too less insulin. Here overdose means too much insulin. So if the pump malfunctions and releases too much insulin, so what happens? The patient experiences an overdose. So this can be led to hypoglycemia, means a very low blood sugar. So what will be the coding guidelines for this? First one. The first principal code is use T85.6. So what you have to assign this code means to indicate that the mechanical complication of implant or any prosthetic devices. So insulin pump is a a prosthetic device, right? So any complication, either it may be failure, either it may doesn't work properly. So any complication comes under the category under T85.6. So this shows the pump is malfunction. And the next code, you have to give the next code as T38.3x1. So what it is? A poisoning. It describes the poisoning by insulin and other oral hypoglycemic drugs. So this shows that too much insulin was delivered by the accident. So first say the device, that is insulin pump, is broken. So then say too much insulin entered the body by mistake. So this is all about the diabetes mellitus. Now coming to secondary diabetes mellitus. So what do you mean by secondary diabetes mellitus? Secondary means it is not a primary condition. It is always happens. It is always occurred by because of the another disease reason, right? So the secondary diabetes, it happens because of another disease, because of another surgery. So because of another effects of the medication that damages pancreas or affects the insulin function. So always identify and code the underlying cause. What will be the underlying cause? For example, like cystic fibrosis or pancreatic cancer. And the next one, the type of complication. So what is the type of complication for this disease? And the third one is the secondary diabetes code, E08 to E13. So the codes for secondary diabetes mellitus is E08 to E13. Secondary diabetes mellitus and the use of insulin, oral hypoglycemic drugs or injectable non-insulin drugs. So patients with secondary diabetes mellitus, so they do not need long-term treatment using insulin or drugs because they already have been used on long-term basis. So here, to show that these drugs are being used, additional codes from category Z79 should be assigned. So what are the coding guidelines for the secondary diabetes mellitus? If the patient uses both insulin and oral hypoglycemic drugs, if he uses both, you have to code both of them, Z79.4 for long-term use of insulin and Z79.84 for long-term use of oral hypoglycemic drug. For example, when a patient is diagnosed with secondary diabetes after pancreatitis, you are getting my point, right? After pancreatitis, a patient is diagnosed with secondary diabetes. So he is taking the insulin and metformin. So what do you code here? You just assign a code Z79.4 and Z79.84. So if when patient uses both insulin and injectable non-insulin anti-diabetic drug, then also you have to code 2. Assign Z79.4 and assign Z79.85 for long-term use of injectable non-insulin anti-diabetic drugs. So for example, when a patient is diagnosed with secondary diabetes, which is due to a pancreatic surgery using insulin and GLP-1 drug, so you have to assign the codes Z79.4 and Z79.85 in this condition. So what is the important note over here? You have to always assign the code Z79, but these are only the additional codes. They should not be used as primary diagnosis. They should not be coded first. They are always the add-on codes. So first you have to give the condition and then the additional codes. So they show the patient is currently on long-term therapy for diabetes. So that's why we assign the codes from the Z category. Now coming to next slide. So assigning and sequencing secondary diabetes codes and its causes. So how do you sequence the secondary diabetes codes? How do you assign it? First, you have to understand what is secondary diabetes. How does it cause? So it occurs due to another medical condition, right? Due to another or due to other external factor, always the secondary diabetes occurs. They may be surgery, they may be intake of the drugs or chemicals, and they may be another disease like cystic fibrosis or pancreatic cancer. So how do you assign and sequence now? The sequencing order of secondary diabetes codes depends on the cause of the diabetes. So it always depends upon the cause of the diabetes. The cause is usually coded first and then a secondary diabetes is coded. So you should never code the secondary diabetes first. You should always code the cause first and then secondary diabetes. Secondary diabetes mellitus due to pancreatectomy. So what do you mean by it? Diabetes that develops after surgical removal. So after pancreatectomy means removal of pancreas, right? So pancreatectomy is done before itself. So after removal of pancreas, a secondary diabetes mellitus develops, which leads to lack of insulin production. So in this case, you have to assign the code E89.1. So this code, it identifies the diabetes occurred as a complication after the surgery. Okay, and so what is the important note over here? Z79.4, long-term use of insulin. So this should not be assigned because Z79.4 is only the long-term use of insulin. Here, insulin is not used for long-term, right? After the surgery of removal of pancreas, they have given insulin as they develop the secondary diabetes mellitus. So this is only for short term. So you have to not assign the code Z79.4. So you have to always code only both. What are those? The first code is for cause. E89.1 for post-pancreatectomy. And the type of secondary diabetes, for example, E13. And secondary diabetes due to drugs. So secondary diabetes is also can be caused by the adverse effect of correctly administered medications, poisoning or sequel of the poisoning. So whenever you develop a diabetes or you develop another condition, you just doctor give you or he prescribes you some drugs or medicines, right? So sometimes these medicines can create you an adverse effect. Sometimes they may give you poisoning. It leads to poisoning. So in those cases, you can code the secondary diabetes as this secondary code, and the first code is from the T series, from the poisoning code chapters. So this is about the secondary diabetes ICD-10-CM guidelines. Yeah, this is all for today's session, guys. In the next session, we will be learning about the anatomy and physiology of one more body system. Thank you.